Health Organization defines health literacy as the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways which promote and maintain good health. Research increasingly indicates that health literacy is a strong predictor of patient adherence and key health outcomes. Poor health literacy is a stronger predictor of a person's health than age, income, employment status, education level, or race. When a patient brings a high level of health literacy to an interaction, it offers a significant advantage and facilitates effective shared decision making.
Patients with high health literacy are often keen to play a meaningful role in their care and treatment, and it is important for providers to recognize this motivation, to positively respond to it, and to capitalize upon it as a therapeutic asset. We call this practice accommodating up. Because providers experience a far greater need to accommodate down to patients' literacy levels, patients with high health literacy highlight gaps and challenges in communication practice. These challenges, if not handled correctly, can result in loss of patient trust, disclosure, and adherence. Providers should be attentive to the information that these critically literate patients bring to interactions. Illness can be defined as the experience of disease, and as such, the patient will always be more knowledgeable about their illness than the provider. It is the role of the provider to invite, encourage, and support this knowledge in treatment. The two primary methods of accommodating up are inviting, not directing, the use of open-ended questions to obtain history and symptoms to encourage and facilitate patient insight, and reinforcing patient autonomy, the use of direct statements that acknowledge and accept the patient's autonomy and the value of their knowledge.
The purpose of the CME is to demonstrate the acts of accommodating up and highlight the differences between accommodating high health literacy and ignoring it. In this module, we present two scenarios. The first scenario is a patient-provider interaction that does not confirm the practices of accommodating up to a patient in critical health literacy. The second interaction presents the same scenario, but with the provider choosing to accommodate up to the patient. There will be a brief review between the two scenarios.
So Monica, I've looked over your historical records from your previous doctor, and your average lithium level was between 0.5 and 0.6, and your most recent test results came back at 0.35, which is lower than your previous tests, which were already significantly below the therapeutic threshold. We will need to increase your dosage.
I really would prefer not to increase my dose right now. The 600 milligrams has been working really well for me.
Clinically, your current level of blood serum concentration is ineffective. Usually patients need a level at least 3 times yours to experience symptom relief.
I understand that. However, I have an extensive history of high sensitivity to medications, as you can see in my records.
Lithium doesn't work at levels this low.
Well, it seems to have been working well enough for me for the last several months. My former doctor and I had an arrangement that the prescription would be written for 1,200 milligrams, but that I could take 600 so long as I didn't notice any increase in manic symptoms. If I did notice an increase in manic symptoms, I would then increase to the 1,200 as written, and I would call him and notify him that my symptoms had changed so that I could see him immediately.
I don't agree with that assessment, and I'm not comfortable with you changing your own doses. We can increase your dose to 1,200 milligrams and test your levels in 1 month, or we can find you a different medication.
In the previous interaction, the patient indicates critical health literacy in several ways: through autobiographical knowledge of her condition and treatment history, support for her objections to increasing her dosage, and a prior treatment plan that indicates good judgment and competence, which was devised and approved by her previous provider. Here, the provider ignored those verbal cues and engaged in communication that denied the patient her ability to use her critical knowledge and to play an autonomous role in her own care. In the next interaction, we will see the same patient and provider, with the provider following the practice of accommodating up.
So I've had time to look over your historical records from your previous doctor, and your average lithium level was between 0.5 and 0.6. Your most recent test results came back at 0.35, which is lower than your previous tests, which were already significantly lower than the therapeutic threshold. I feel like we need to increase your dosage.
I would really prefer not to increase my dosage at this time. This dose has been working for me for several months.
Okay, so I remember from our first appointment that you've been in treatment for several years. Side effects have been an issue for you, haven't they?
Yes.
Okay, so what are your primary concerns with the lithium?
Higher doses give me nausea, hair loss, I overheat, and it really limits my cardiovascular function, which is really important for my self-care.
Okay. So you're worried about your physical activity being limited in addition to the gastrointestinal issues?
Yeah.
Okay. Have you been experiencing any signs of mania since you started?
No, the arrangement with my previous doctor was that he would write the prescription for the higher dose at 1,200 milligrams, and I would take 600 so long as it was working for me. But if I started experiencing any symptoms of mania or hypomania, I would immediately jump up to the 1,200 and then also call and make an appointment to talk to him as soon as possible.
Okay. That sounds like a reasonable plan. Is that how you want to continue?
Yeah, if you're willing to work with that.
I am. You've been dealing with this illness for a long time, and your history was very detailed and reliable. If that plan's working for you and your previous doctor agreed that it was a functional treatment plan, then let's not rock the boat.
Thanks.
Accommodating Up is a communication practice that allows providers to positively engage with critically health literate patients and to overcome paternalistic models of communication. In the first scenario, the patient is effectively subordinated by the provider's tone and dismissal of the patient's concerns. In the second scenario, the provider indicates awareness of the patient's history and invites the patient's knowledge in multiple ways, and closes by acknowledging the value and utility of the patient's ideas, reinforcing her autonomy. Critical health literacy in patients is a clinical and therapeutic asset that should be nurtured and not negated. The practice of accommodating Up is designed to benefit both the patient and provider for better health outcomes and better communication skills.